I'm going. We're back. We're actually in studio. We're back from travel for now.
For 2 days.
Which is great. We're back from travel, shooting another episode. It's great to be here. I think this is episode 83, 85-ish, somewhere in there. So how long have we been doing this? A year and a half?
A little longer, almost 2 years.
Yeah. So episode 80-something now. Anyway.
And we'll be heading off to Hawaii in 48 hours.
Looking like a jackass in your Hawaiian shirt on here.
Yeah, there's a reason for it. It has rockets on it. It's a custom.
Yep.
Our own.
Got our top agent trip here in 2 days, so Mike's repping.
Yeah, we've got these custom Hawaiian shirts with the rocket, rocking the Agent Boost colors. So we're going all out for this trip. So
I was gonna say Red Rocket from Cartman from South Park.
Got the Red Rocket. If any of you want to ever work with an FMO that really hooks up their agents and top producers,
there we go.
Let us know. Always following CMS compensation guidelines as well. Just putting it out there.
It's good that you put that out there. Yeah,
otherwise we'll have trolls in the comments.
Yeah, I think we wanted to at least kick off this episode. We're now starting to see more movement, more to talk about. I think we're at that stage of the year where we're starting to read between the tea leaves, and obviously a lot of people were at Medicarians last week in Las Vegas. So we kind of want to recap that. I want to talk about dire wolves as much as I want to talk about Medicarians. To be honest with you. But,
well, it was a long, intense 3 days for us for sure. So lots of meetings. We shot 5 podcasts while we were down there. Had a lot of meetings. Talked to a lot of agents. So why don't you start with everybody instantly hopped on LinkedIn and opined all of their thoughts and their takeaways. Everybody wants to rush to be first.
Yeah, just so everybody knows, we thought about actually even going live. We have a platform where we can actually shoot live and broadcast live and do everything. And we thought about that, but we also like to try to procure our content a little bit and clean it up. And we didn't want messy, crappy audio and all that kind of stuff. So we found that, to Mike's point, a lot of people really quick went to market fast, shot little side videos or posts to LinkedIn. And we did shoot 4 to 5 actual podcasts there that we're editing, and we'll be dropping those over the next 2 weeks. So we thought about it, but that's just kind of the format we landed on. It was tiring and exhausting for us, at least. But we kind of want to talk about, the different people that come to Medicarians, and I think what they get out of it and why they come to it or don't come to it. I think for us, most of the reason that we go to Medicarians is just because of our, place in the industry and our place in the supply chain, that we touch a lot of the business from everywhere, from rule makers and, sales leadership at these different payers or carriers, all the way down to agents and agencies who are writing the business. So we touch a lot of the parts of the business. And for us, we can park in one place for 2 or 3 days, and it saves us 15 or 20 trips to go and have a break bread, so to speak, or have a meal with some of these carrier partnerships that we have. That's really the intent, or the reason that we go there. We're able to get some quality FaceTime and strategy with some of these partners. And so that's why we end up going there.
Yeah, and usually, I've gone to literally hundreds of trade shows throughout my career in different, different lines, different areas of business. And there's a lot of pre-planned activities and meetings that you have at these trade shows, but then there's a lot of value in the serendipitous meetings with people that maybe you haven't seen, or they're somewhere else. And, you
sometimes
have
the deal's made at the bar or on the golf course, right? It's not, the deal's not made in the...
And that's where the real value is of those type of events is, being in the room where it happens, meeting with people face to face, growing and cultivating those relationships. And, it's great to be many years into the industry now and have friends across all aspects of the industry, all over the place, all over the country. It's like a reunion to be able to get to chat and catch up with a lot of those people.
Yeah, so I think for us, we always have, there's more for us to do and accomplish than we have time to do. Unfortunately, we were booking meetings from a breakfast meeting every day all the way through till a dinner, and then a post drink, and then we were wrapping up a lot of times at 10 or 11 p.m. So it was busy for
I didn't
us.
even gamble $1, which is the second time ever.
I walked away with maybe $200 or $300 from Vegas, which is
left over or profit.
profit, which is saying something,
Yeah.
you know, which is actually a good thing. Vegas is usually not good for me. This is more like I always mentally figure out what amount of dollars I'm going to contribute to the cause and pay like a toll when I'm in Vegas.
Pay some of our agents down in Nevada's taxes.
Yeah,
them,
so I usually donate or contribute to the Las Vegas economy, but I will say I walked away with a few dollars this time, which is good. You know, but yeah, I would just say that the interesting part is like we as an organization have plenty to do, and we really did split up between the 6 or 7 staff members that we have there. You know, obviously we had a booth as well. We hosted the kickoff night and had a presence there as like one of their gold sponsors. So we all had objectives of what everybody was supposed to be accomplishing there, and I think we were fairly effective. But one of the biggest takeaways that I guess I had in talking to people, you know, a handful of our agents went to Medicarians and attended as an agent, and a lot of the feedback was, how was it? Was your first time? What did you get out of it? And I think a lot of them felt like just disappointed, and that it was like, well, what were you looking for? What were you trying to get out of it? And the feedback from most of them was it's still not very agent focused, in the sense that what does that average agent come there to learn or seeking that they wanted to get or derive from it? And they just walked away feeling pretty disappointed in not having the content that they were looking for. That's the feedback that I've gotten from the handful of agents that I spoke to. Is that
yeah, it's a hard melding of an industry trade show and then trying to make it where there's also kind of a consumer focus too, which is the agents. And so I think there's, you know, we'll have a full debrief with their team. I'll say, you know, the venue was rough as far as at least with the casinos and being Caesars and Caesars Forum. We're pretty seasoned Vegas pros, and I did not realize that the Forum was that far away. I think it was like over a mile and a half from my door of the hotel.
Well, Caesars has a conference center there at the Caesars Palace hotel, and so I think everybody thought, I did, you know, I'll be honest, and of course I don't book everything myself, you know. Amber, other staff members, you know, do the booking, but I just thought, oh yeah, it's Caesars. Well, the preferred rooms, like the block of rooms where you get a rate, was at Caesars. So it was like, hey, Medicarians is at Caesars this year. Caesars has their whole conference center there on site. It was like, well, instead of the MGM or the Fontainebleau, it's at Caesars. Okay. Yep. Staying in the Augustus Tower or whatever. But no, this thing was freaking across the street, you know, across the freaking bridge. If you had a haul shit from the hotel there, total nightmare, or taking a Lyft and an Uber around the strip to get there and set up. And I swear I walked like 10 miles every day that I was there.
Yeah, I think that was probably the average. It felt like when I take my kids to Disneyland and we go hard from California Adventureland all over, you know, it felt like Disneyland days for sure. So it was definitely tiring. A couple of my takeaways from agents, you know, I spent a lot of time at the booth. We shot some podcasts. I spoke on a panel. And I think we probably talked to 200 agents and agency owners there. And, you know, one of my big takeaways was how many agents that were ACA agents and agencies that were almost feeling very displaced. There were a lot of agencies from Florida, Texas, California, Arizona, and a lot of them strong in the Hispanic market that have grown pretty good, robust books of business and a pretty good business on the ACA side over the past 4 or 5 years. And now with a lot of disruption on the ACA space, they're panicked and they're looking to, you know, get into Medicare or other ancillary products. And so there were many agents and agencies kind of shopping for somebody that could, you know, essentially be their mentor, fill that void and help them diversify their platforms there. So I don't know if you really had many of those conversations, but that was a huge takeaway that I noticed from agents and agencies of something they were looking for.
Yeah, I did too. And you know, for the record, you know, hablo español. I mean, a lot of us do here at the shop, you know, and that was one of those things. They're very surprised.
We're gringos though. But Dan still speaks good Mexican Spanish.
Exactly.
I speak Portuguese.
Lo llevo bien. You know,
yep.
So I'm good still. But no, anyways, I would just tell you that we're geared for that. We noticed that as well with the Spanish speakers. And then I also would tell you that a lot of these agents too, that we spoke to, or at least that I had conversations with, they almost just didn't know what to get out of it too. And they felt like they didn't know where to be and when to be. And they were just a little bit, you know, and this is not like, if anybody that's involved with the Medicarians is listening, this is not like I'm dogging on Medicarians. I don't want you to take it that way. It was just, they didn't know, with all the different tracks running concurrently, where they were supposed to be and when. And so they did have a hard or challenging time trying to be in the right place at the right time for certain speakers. Or if they were late and you walked into a track, it was like standing room only and you can't even hear anything because it was really garbled. You know what I mean? So that was some of the feedback that I heard from just some of the agents too that had attended.
Yeah, I think some of the panels, the plenary sessions and the one with the CEO of Scan, Sachin, were great. You know, you can listen live to some of those as well if you attended, because it's hard to attend everything, especially like us. We almost don't even get to pay attention to much of the content because we're busy back to back to back.
Yeah, and the other advice that I guess I want to throw this out there. Look, no one's asking me for this, but advice I'm giving to agents and agencies who do attend, whether it be Medicarians, whether it be ICMG, whether it be any other trade show, whether you go to Medicare Con or whatever it is, I would just tell some of you all to just to have some couth, so to speak, and know like what you're really doing, because I can't tell you how often we had agents who would come by the booth and I'm starting to talk to them, and more than anything, I'm trying to figure out like, hey, tell me about yourself. Tell me about your business. Talk to me about your agency. What are you doing? What's going well? What are your struggles or challenges? What are you trying to get from being here at Medicarians? And I'm more looking at it from a perspective of, obviously, if you're here, there's something that you're looking for. How can I help you? And more than anything, it was like, well, hey, what can you do on my contracts? Like, hey, I'm with this partner over here and their booth's, one section over. Can you give me a higher contract than them? And just candidly, I'm just like, piss off and hit the road. I mean, just that's not why you go to these things, right? It's more we're trying to be as a collective in an industry, trying to have a means to help people and solve issues. It's not the environment to go to be shopping the contracts and seeing if you can get $3 hairs more from the next agency or FMO. That's not why we do this.
Well, there were definitely a lot of agents and agencies shopping for that, and people almost brought up like, here's my menu pricing, here's my current rates of what I'm getting or what I can give you. Where could I arbitrage some spread here?
We had to come up with their iPad and go, here's all my carriers. Which one of these can you bid on? And I'm like, none. Have a blessed day.
Yeah.
Like move along.
Yeah, and it's also kind of awkward too if people are legitimately looking for a new FMO, because most of the large entities, AmeriLife and Integrities, are all represented there in some form or fashion, and then you have some of the other FMOs that have a larger presence, and so 87% of the distribution ecosystem is represented in some way, and their staff and employees are there, and it's like if you're disgruntled with your current situation in upline, it's almost awkward.
Well, listen, and I think that's the difference though, is if you're an agent out there that's saying, hey, I'm not aligned in the right place with where I'm at with my FMO or my agency or partnership. Hey, I don't have the technology that I need at my current FMO. I don't get paid maybe full commission, and I'm not on this LOA contract that I don't understand, or I don't get the training that I need. I don't have X or Y or Z. And if you're finding yourself as a business owner not aligned where you need to succeed, that's very different. And I think that's great. You're in a good environment to go and do some speed dating, so to speak, and go talk to different partners and figure out if they're a better fit or they're going to help you grow your business. I think there's a very big difference from doing that speed dating versus, going around to say, oh yeah, no, everything's fine. I just want more money. So here's just like my margins and just give me a better contract. Like I just, for me, that's just not the environment for it.
Well, to be fair, it is a little bit awkward for those agents and agencies with the kind of the speed dating format there. And, but also a lot of our competitors, that's how they do business, that's what their value is they arbitrage their contracts. And so they're more than happy to be like, oh yeah, I can give you a little bit more on that contract and a little bit more here, because some of them don't know what their current value is, how to really help agents outside of that. And, we talked about it a couple episodes ago, where you just know what you're getting out of your FMO. If you just want to, beat your upline up for the most margin on some sort of contract, and you're making a majority of the money on the override, then the resources and the help and the mentorship and the tools are going to be somewhat limited, because you're making the majority of that kind of money,
Yeah.
And, moving on kind of from that, the other funny part of that is then we all go with all the principals and they're all our friends, and we all get along very, very well, for the most part. And it's very friendly at the top for the most part.
Yeah. And yeah, I'll leave it at that. I'll leave it at
with
that.
With most.
No, I'll leave it at that, because sometimes you're like, oh, they want to join your team? Yes, please, good sir. I wish you well.
Yeah, or they catch in the back room and it's like, the team manager is trading the players or something like that.
Yeah. And you're like, I'm happy to make that trade.
Yeah,
Done.
exactly. Anyway, the other big thing that I noticed in talking to a lot of agents, I would say probably the thing they were the most concerned about, because not every agent was an agency there, was commissions, right? That was like what was on the top of their mind. I heard it in a lot of panels. The panel that I spoke on, it was pretty much a consistent question you had all throughout was, where, is my money safe? Are we through the rough days? Are the PDP carriers going to reinstate commissions where they pulled them back? Are we going to continue to see a pullback of more plans going commissionable and suppressed?
Yeah, I think that was the lingering thing. I think that as far as takeaways from Medicarians too was tech focus, AI, and then same thing, it's agents and FMOs, and compensation and commission is not out of the woods yet. It's still under fire, and most of the agents, that's what they were asking. Same thing is, your question, commissions, what about them? And I would just say TBD still. I think that the two big things we talked about ad nauseum were obviously the PDP going non-commissionable with multiple carriers last year, and then also where we had a hard time with, like I really do understand, a carrier saying, hey, like economically or financially, this plan, the funding environment, it's having a tough go. We're going to hit pause on growth for this plan. I understand that. Not that I like it, but I understand it. Where I think a lot of people had the most heartburn was the slow roll and the changing constantly throughout AEP. And I addressed this in a previous episode where we say it's a bad look where on October 15th, you can sell a particular plan, or October 20th. And then it's, November 1st, and you get a referral or a spouse or somebody else, and they come to the same agent and say, hey, I want to enroll in plan X, Y, and Z that you helped my neighbor or my friend with. Mm-hmm. You're out of luck. I can't help you with that anymore. Because 2 days ago, they made it non-commissionable, so good luck.
Or it gets suppressed, and they contact Sunfire or Send or whoever and pull it from the platform because it's suppressed, and then the agents hit you up and go,
yeah,
why did you pull this off the platform?
Or you're going like, let me go hunt around and see if I can download a PDF at a carrier thing. Oh, nope, they took that down. The PDF links down, so I can't download. Let me call broker support. Oh, they're going to mail me a paper kit, eventually. And by the time you get it, AEP's over, right? So, I mean, they made
it's like you're in luck. That plan is still commissionable. Yeah. You just have to go on this quest to be able to find out how you can find a paper app and where you need to submit that. And if you do so, you can thusly be rewarded.
And if you hunt around long enough, you might be able to find the fax number that you send that paper on to.
And then we'll begrudgingly take it.
So that was obviously a conversation point with a lot of them. And I would say that I am not a big fan of heavy regulation, but I would be okay with somebody saying, hey, we're okay. The carriers only have so many like levers to pull, so to speak, to manage their plans. And so I get it. But I would be in favor for them setting a rule to say, hey, if a carrier is going to go suppressed or non-commissionable, here's the drop dead date for them to kind of announce that. And then after that date, like you got to let it,
Well, one of the guiding principles of commissions with CMS, one of the North Stars is how do you create a commission environment where there is no financial advantages or disadvantages to selling one carrier over the other to prevent steering, right?
FMV, right?
FMV. It's all almost everything they do regarding commissions is geared around that. But yet then you have these scenarios where it does create steering, because then they're actually steering themselves because they're going, well, this plan's available. It's filed. We agreed that this was going to be available in this marketplace, but now we've suppressed it and we've made it non-commissionable, and it does generate steering. And so there's
well, it's like we got 1,200 too many enrollments than our actuaries had forecasted for. So we're at our limit. So now it's suppressed and you can no longer do it. And of course it just steers everything away to other plans.
Yeah, we try to be great partners with all of our carrier partners, but that was a tough one to swallow, especially on the ACA, the Medicare Advantage plans going commissionable, non-commissionable,
so
suppressed.
Yeah, that wound is open still.
Yep.
That wound has not healed. That is still a hot topic, just so that everybody that's listening knows, from the broker side, the carrier side, the regulatory side, that is like a hot button issue for a lot of people. And then I don't know about you, but my other topic too, beyond just like the commissions and non-commissionable and suppressed.
Let me finish my thought before you move on from commissions, because I did answer a question at the panel I talked about, and I said a week ago, yes, I think that's going to continue. I think you're going to see more plans go non-commissionable and suppressed. I actually think we got a little bit of a reprieve on having non-commissionable plans being proliferated out because of what we'll talk about later, which is the increase in the funding environment. So, sorry to just cut you off.
No, the other one was, of course, the Inflation Reduction Act, which has, while it has a couple positive ideas or things that it's trying to solve, there's some pretty big negatives there to the Inflation Reduction Act, the IRA. And, this last year we did this big demonstration period, like we talked, we pulled it out of a rabbit's hat. And really, I'm not going to name who I talked to, but a very smart individual in the industry who said, yeah, they took those funds from the innovation fund of CMS to fund that demonstration period. But that is what's there for, obviously investment into technology, into X and Y and Z. And they basically took from the coffers there.
CMS robbed their child's metaphorical college fund.
Yes, they did. Exactly. Is a good metaphor. Yeah. To do that demonstration period. And the real question is, well, then what about for this year and moving forward? And I think that's ultimately what we'll get to in this additional funding to Medicare Advantage is, it's still ugly with some of the components of the IRA with PDP plans. And the idea right now is to kind of rob Peter to pay Paul, and they're going to, siphon some of the money from Med Advantage in order to kind of keep the PDP afloat, as right now, like a kind of a stopgap measure for PDP. But I think that was another one I had with several people is, what the freak are we doing with all these negative financial impacts from the IRA that is still in effect now? This can't stand long term. It's bad. And there's a lot of lingering effects from it that need to be addressed. Either it needs to be repealed and rolled back, or we need to make some modifications to it. And it's not being addressed right now.
Yeah, there's two things, the Medicare, the 2026 final call letter, which we'll see if that's final, the CMS call letter, final rule. We'll see if it is the final rule, if there's like final rule 2.0 and 3.0. But they did address a little bit of that. And then there's some other news there with the funding increase that we also heard about. But before we kind of parlay into those things, one other takeaway that I had from the industry in general was, like we've been hammering for the past year, financial headwinds and pressures all around, right? If you listen to most of the panels, you heard about, the health systems were talking about their healthcare costs and their woes, and the carriers were talking about, their increased costs and their woes, and agents were complaining about.
Well, they were talking about GLP-1s too, and how bad that crushed a lot of these plans and sucked all their profitability out and put them in the red because of how many GLP-1s they were covering. So.
Yeah, and there's, so it was the tone a lot of times with a lot of these panels was, it's bad news all around, bad finances all around, bad economics here and there. And in a way, it kind of seems like everybody was kind of fighting for themselves and advocating for their own, portion in the ecosystem. And I do think that that's going to continue a little bit this year, as we've talked about. I do think that it's going to be slightly more positive than we initially thought, just like last year.
Yeah.
And the new administration's already stepping in quickly to ease the burden on the especially MA stuff, because typically Republicans, and we've heard Dr. Oz is pretty pro MA, and we've seen really hard effort from both parties to proliferate the Medicare Advantage across the country over the past 10 or 15 years. And last year we had a major stepping back in that direction, and the way things were trending for this year was probably another significant pullback, giving up a lot of ground.
Yeah, and one of the things that I will talk about with the funding environment, I will be honest, I can't remember the percentages. It was proposed to be 2-point-something%, and it increased to 5-point-something%.
And then 5 and 9 on it. Yeah.
Yeah, you have the numbers.
There's the PDP side, and then the MA side.
Yeah, but they pretty much doubled the numbers
of what was expected.
Yeah, what was expected on the increase, which was really significant. In our business, in our industry too, when you start to hear like a percentage point or 2 or 3, that sounds like a small thing because it's a percentage point or 2. It's not. It's massive when you really, again, start to think about an insurance company and their MLRs and 85-15, and sometimes when you have a company that's doing 2 to 3%, profit margins, they're crushing it.
Yep.
So there's thin margins. So when you talk about an increase doubling by a couple percentage points, it's massive, right?
Yeah, it's the difference between, are we running in the red or are we profitable this
correct.
year?
And I think the reason I'm just going to bring this up as a big point is, even a few weeks ago, I was looking ahead at, we're in bid season right now where all these carriers are filing their plans. And I just wonder how many plans we're looking in the boardroom going, are we going to do this? Are we going to stay in Medicare, or are we going to like roll up our tent? Are we out of business? There's so many insurance plans or payers that lost their shirt the last couple of years, and they've just been kind of like hanging on. And the other thing that happens that people don't understand is they all keep reserves. And there's reports out there you can read where some of these carriers have been running and really dipping into their reserves. And if the trend continues, they get past their reserves to where they're getting into insolvency. And there's multiple ones throughout the country that are kind of making their way there.
On the tilt,
and so I think that having this increased funding has probably saved several of these plans throughout the country to where they can kind of give it a go. It's probably made a couple of these plans that were not going to make any profitable. And the bigger thing that I think it can do potentially that I've been in favor for is by increasing the funding environment, it allows plans to bring products into more rural areas where there's FQHCs, where we saw this big expansion of, Medicare Advantage plans throughout the country and more coverage options with this higher reimbursement rates. A lot of those plans were the ones that were folded up, over the last couple of years. And so I think that if we see this environment continue, it allows expansion of plans and products in those rural areas. So,
yeah, that's great. I mean, we're going to talk more in depth about a lot of those things. Just kind of my final piece that I wanted to cover or take away from Medicarians before we kind of move on to call it or another stuff was, I think that ancillaries are still poised for a big moment, right? Plan enhancers, indemnity plans, dental vision hearings, a lot of our great partners at like UH1, Golden Rule, Allstate, NCD. I think that everybody universally, whether you're on the ACA side of things or the Medicare side of things, there's headwinds tailwinds to sell those other ancillary products because, ACA, there's going to be a focus on better quality, less policies, and bundling those services with them as more of a quality sale. So a lot of ACA shops are really trying to, the attachment rate of indemnities and DVH are really a big focus right now, ourselves included. And then on the Medicare side of things, as we keep seeing, these dental vision hearing benefits, because again, these are not baked into actual Medicare, start getting peeled back, and plans aim for more profitability than having a whole Christmas list of sexy Santa Claus benefits. Those are going to be more utilized there as well. So pretty much everybody seems to want to be getting involved in the ancillary products as well.
Yeah, and I would add to that in a more granular level too, that on the Medicare side, we're seeing, of course, talking about a little bit of, still tough environment. And look, some of these carriers, even though they've gotten a reprieve a little bit on the increase, they need to still go back into a better position financially, rebuild their reserves and stuff. So they're still going to be very cautious with their bid filings this coming year. So you're not just going to see things rebound and just yo-yo back to these sexy benefits, right? They're still going to be very vanilla. And we're going to and I've already seen the trend with a lot of our broker distribution where they're not trying to write the very enhanced plan for a lot of people who want a dental or enhanced hospital coverage. They're going to put them on a buyback plan or like a zero premium plan, something that's basic but has a good chassis and functions very well for healthcare coverage as their major med, and then they're adding in those ancillaries, and they're positioning it that way from to the consumer, and they're selling a lot and having attachment rates of sometimes 50+%. So they're doing it and having a lot of success that way, to your point. And these carriers are also getting a lot better about making it easier for agents to write business and to quote and enroll, and doing the integrations with Sunfire or others are making the process like very, very easy. Allstate's made it extremely easy with their link, for the call center environment too. So I think the ease of doing business, the consumer wants it. And then on the ACA side, of course, we're finding that, obviously enhanced subsidies is another thing we'll talk about that's kind of still up in question. But frequently for those who are selling out there, they're not selling gold plans a lot. I mean, it's great. We would like people to sell gold more, but they're still seeing a lot of bronze, some silver, and when they're selling the major med, they have high deductibles or they have HSAs or whatever, and so they're looking to kind of offset that large deductible or that HSA with the dental, with the hospital coverage, with those other things. So we're just saying, hey, educate your consumer, use that as part of your overall value and offering to your clients. If you just change and modify small behaviors, it can be a huge difference maker to not just you and your business, your financial bottom line, but also to that consumer who don't make the decision for them, educate them, and let them choose whether or not they want to add it to their overall coverage portfolio.
Yep. So. Yeah, perfect. I think that's kind of, summarizes my big takeaways from, the industry concerns and kind of what's going on, areas to focus on for us in the business. And then, hot on the heels of coming back, you were back out of town, and then CMS released the final rule on Friday, at least. And what was interesting was what was in it, but notoriously what was not in it, right? They basically didn't address anything on the Medicare Advantage and PDP side of things of commissions for agents, commissions for FMOs, any marketing guidelines. Nothing was changed or touched there.
Just sweep that under the rug.
It was ignored, right? So there was a lot of it, just status quo, right? It is kind of read between the lines, or I guess no news is good news there. And then there were also a couple of other things where they just said, hey, we're not going to pursue this, right? And again, I feel validated, and I feel very right in saying, 6 months ago when we were saying, hey, a lot of the stuff that CMS is trying to pursue is just, it's not going to happen, right? It's pie in the sky. It's too much to implement, and the new administration is just not going to have the will to drive forward on these.
Yeah, they're going on a snipe hunt.
Yeah, and a couple of, those things that CMS specifically said in the call letter of, well, we're not going to address or we're not going to ingest is, like the AOMs, the anti-obesity medications, forcing CMS and Medicare to cover all of these GLP-1s and all of these, the newly coined AOMs, anti-obesity medications. And I think that was a big reprieve for the industry too, right? Because that was a shoe that was waiting to drop with a lot of financial pressures of figuring out how to
and then
pay for those. Yeah.
Then it also comes down to, look, a lot of these carriers, like prior auths, are very much under pressure right now from carriers, and those are things that for sure they're going to try to want to put some guardrails on and prior auths on and restrict usage, and then it's going to spike complaints and quality and star ratings and, more lawsuits and more issues because, again, I don't know how many carriers would be really hot to start covering a medication that's $800 a month, indefinitely for somebody with not really having longevity and trials on outcomes and everything yet still. I mean, it's still very early on to know about, does this actually reduce cost of healthcare for these people long term, and what other side effects exist still. So I think that's another part of it.
Yeah, the other big component that the prior administration, the prior CMS administration was really big on, that had put it a lot into the prior two call letters, was the health equity side of things. And
they rebranded that.
Yeah.
It's still around, but I can't remember the new term. Somebody will comment or put it in the comments, I'm sure.
Well, but they did say they're not going to pursue a lot of those initiatives.
Yeah, but just so everybody knows, the what they would call like DEI or health equity initiatives, it does still exist. In fact, there was an article even this week on Becker's that they wrote about how they changed the name and they've kind of retooled it. They will have a few different like metrics there, but obviously like from like a population perspective, geographically, socioeconomically, where people are, those things will still exist. It's just under a different name. So
yeah, and they're, I think it was a little bit disappointing that they didn't clarify some things in a way that CMS yet didn't clarify some things that had been lingering out there. But it was also a little bit of a relief in some way, shape, or form that they didn't, take further action on a lot of things. Probably the most significant thing that would affect us in our industry they did codify some of the things on the Part D landscape, codifying specifically the M3P, the Medicare Prescription Payment Plan. They basically said, yes, this is going to go through forever. The carriers, you're going to fund this. You're going to smooth out those payments. And if they've enrolled in it and they stay enrolled in the plan, it will roll over to the next year. And they talked a lot about those funding mechanisms here too. So, again, just as a reminder, that was legislation, right? That was part of the Inflation Reduction Act Yeah.
And just so
excellent health outcomes.
I'm sorry for anybody who knows me, I have like all the D's, like I have like ADD and OCD and all this stuff. And so like, I would not be able to continue on this podcast episode without being like, I was like, damn it, this is bothering me. I read this article. Why can I not think of the name of the new program?
That's a worse name.
It's a worse name. They had a rebrand, Health Equity Index. It's now called the Excellent Health Outcomes for All, which is different. So
I mean, will it actually focus on excellent health outcomes? How do you
EHO for all? That's a terrible
EHO for all.
That's a terrible acronym.
Man, this industry is the worst at branding and coming up with stuff.
A2 offer sucks from United Healthcare too, the name of that program. But
yeah. Well, so they back to kind of the Part D stuff. They did codify the M3P, the Medicare Prescription Payment Plan. And again, it's not something that CMS could just kick aside and say, hey, we don't want to deal with this, because it was part of that Inflation Reduction Act. It is legislation. It's the law of the land. And, it would take a repeal of that act or that portion in particular to change that structure.
And I think there's one other thing that at least we're kind of all over the place, but talking now about Medicarians call letter industry, what was really on that call letter, what wasn't on there. There's kind of two things that I really wanted to talk about too, just time of year and everything else that's going on. And the first one is about, just CTMs, complaints, things like that I feel very, very, very strongly about and keep pushing to CMS. I keep getting really frustrated about these gigantic numbers that they present of CTMs that are just not CTMs. 50 to 60% of all, and I was going to post on LinkedIn the other day, and if I find 13 minutes in my day today, maybe I'll post on LinkedIn about this anyway, but 50 to 60% of all CTMs that come in are not really CTMs to the broker. It's somebody calls in to CMS about their plan. They don't understand something, they have friction, it could be for a myriad of reasons, or they just want to change their plan. And the only mechanism for them to do that is if they make a complaint against their agent, and they make and they get coached and coaxed into, would you like to complain against your agent? Like, I guess, yes, I want to make a complaint. And so the complaint is the mechanism that gets them the ability to get a CMS award to change their plan. And I think that's so broken, because then the numbers are very, very, very misrepresented on the CTMs to this much larger problem than really exists. And then also, like, I would rather focus our time, instead of chasing our tail for all these, just ridiculous CTMs that we constantly either talk to the agent, have to go through our compliance officer, get recorded phone calls, go through it. Someone very clearly said, yes, I gave consent to enroll. And they're saying, hey, we're making a CTM. This person didn't want to enroll in a plan. No, like it always comes back unfounded, but it's a lot of wasted time and resource, and it paints a bad picture for the broker. I would like to see them doing something to change or address that. Like, seriously, that needs to stop. That's like one big thing. And then the other thing I was thinking that kind of goes with it, that second thing, is this year is the first year that carriers are now going to have to start sending out the letters in June. And I'm bringing it up now because it's April. It gives you guys all plenty of time to think about it. But in June, plans are going to send out their utilization letters, right, on like any of those ancillary or extra benefits, just like people would get a utilization on where they're at with like the gap or their prescription drug usage. Now they're going to have the plan send out in June if they've utilized extra benefits. They've not had to do that in the past. I think that by having that touch point go out to everybody this year, you're going to see a gigantic spike of calls into CMS too. And I think you're going to have a lot of even duals that want to change their plan too, that are not in hidey-fighty states where it's fully aligned, and they want to change their plans, and they're not going to be able to. And I think we're already going to see this gigantic spike in CTMs in June when all those letters start hitting. And it's like I can just see this train wreck coming, and none of the carriers in CMS are planning on this, and it's going to happen. And anyways, I'm just telling you all as brokers, you should be preparing for servicing your books of business mid-year in June, because it's going to create some more disruption coming up.
Yeah, I think certainly it's just going to create a lot of service work too, and a lot of questions of like, well, what's this, and how do I use this, and I think there'll be some good that comes out of it, of course,
Bingo.
but there'll probably be a lot of,
it's just friction again.
Yeah, a lot of friction.
Like, look, you already know, like you have your seasons in friction during like AEP, and then, you have like OEP again, and there's all these, it's cyclical, and you have all these peaks, but then usually historically in the business, summer months are somewhat slow in the business. And now you're just going to create this element where, every person on a Medicare Advantage plan is going to be getting their utilization letters, and it's just going to spike up all this service work again in June. It's just like stirring the hornet's nest a little bit. So it's just expect it, plan on it. Going to be more CTMs, going to be more service work, going to be more protection mid-year. And that's a new element too that I just think is timely that we should be really talking about.
Yeah, moving on kind of to what I consider some really good news, which we haven't had a ton of good news in the Medicare Advantage world, especially from funding. And it basically broke over the weekend and early Monday morning that all the carriers were waiting for the rate notice, right? The rate announcements for the funding environment. That's what we heard from all the carriers at Medicarians. And they send out what's called an advance notice, right? Where they say, hey, this is roughly how much you could expect.
Yeah, advance rate
and
notice.
That advance rate notice was roughly an increase of 2.23% overall, right? And the effective growth rate was set to be at 5.93%. And it ended up coming out, and the actual rate announcement was the effective growth rate was 9.04%, and it ended up being 5.06% overall expected change in average revenue, and that's honestly monstrous in my opinion. And when you're talking about profitability being a difference of a couple points of margin, this really is going to create some breathing room for a lot of these carriers. It's going to, if they do a good job and don't, screw things up, they should be able to tilt the profitability back to doing well. And I think it's really going to benefit some of the carriers who already were doing pretty well anyway. And we're going to see good benefits. We're going to see expansions. We're going to see less SARs because of this. And so I think it was really, really overall good news.
Yeah, but the one challenge too that I'll add to that, and I agree, the one challenge that you're going to have with it is you get this advance rate book, but then all the carriers were already filing their bids. Like they were already doing sprints, their actuaries, their bid planning team, they were already meeting. They were already planning out for literally every single HICN that they have throughout the country. What were they going to change or tweak on their benefit structure? And they already had preliminary filings ready. And now that changed, of course, now it's like they found a lot of money in the couch cushions, a lot of money. Mm-hmm. And so now they're going to rechange all their bids and they have to go over and do it again. What that's also going to do is there's going to be a big gap again with the NABA, that national average benefit amount, like that NABA amount. And so I think we're going to have a similar environment though to this last year where, now there's a big gap and plans are going to be filing, but they're not going to want to show their cards again. And we're probably going to be in the same environment where rather than the rates being set and everybody knowing what it is, there's going to be a larger gap on NABA and they're going to delay rolling out their benefits more, I think. So.
Yeah, and there's also some ambiguity and things left to clarify on the Part D side of things, especially with, the Inflation Reduction Act and all the impact there. So there's definitely going to be some things still that need to be ironed out. But overall, I do think it was good news. Now, I was pretty surprised about it, honestly, because I kind of felt like the tone of this current administration was like, hey, we're getting our financial house in order, and we're going, it's going to be lean times ahead for the Dragon House. It's a quote from Friends. Look it up, Mosiah.
Looks like it's going to be a lean Christmas at the Dragon House this year.
Yeah.
Lean times. And I was expecting it to...
Rice and beans and rice.
Yeah, exactly. The CMS was going to be on the Dave Ramsey plan, right? And it looks like, not so much. So hopefully the philosophy is that, we cut some areas of fraud, waste, and abuse, and identify some of those areas, and we can reallocate that misappropriated spending into good areas where we need it. And that's kind of best case scenario. But I'll admit I was a little bit surprised that it came out so favorable.
Yeah. And so I'm really also hoping along with that it's like, again, hey, from a macro or every step in the supply chain, if there's extra dollars there going to the plans, that hopefully for our listeners, who the majority of them are probably agents and brokers and agencies, the hope or the thought would be, hey, there's that extra compensation or extra dollars in the ecosystem. Hopefully the days of let's squeeze the brokers until they squeal for every last penny, and let's cut comp and everything else. Hopefully, some of that has subsided with this.
Yeah,
right?
absolutely. A couple other, things, just rapid fire things that I thought were interesting. Doge announced that they've been going through auditing all the Social Security payments and all that stuff too. And they're basically going to rebuild the coding database, because as we know, it's historically...
Well, it sounds like, from what I read, it was like 40, 50 years old.
Exactly.
Like a really, really old, antiquated database without like unique identifiers. And and a lot of the fraud, it sounded like, was not necessarily in Social Security payments to them, but once they were in the system for Social Security, then there were other government databases that basically didn't talk or validate back and forth to one another. So then they would get other benefits through other government agencies, is what it sounded like when I read.
Yeah, and then another interesting, headline of the week was Dr. Oz kind of had his town hall or summit for, what he wants, what he envisions for CMS. And a big focus, of course, was like AI and AI-driven in healthcare, and specifically even like AI avatars, which honestly, I think AI does a really, really great job of identifying and diagnosing things. I recently ran all my own blood work through AI, and it was probably better than getting a consult from 2 or 3 different doctors at the same time. A lot of good things there. And I think that...
How did your blood work turn out?
Pretty good.
Let me guess.
Not perfect, but
you got to reduce your cholesterol, or your stress, or something like that.
Yeah, I shouldn't eat red meat, right?
Something like that.
Not too shabby for my age.
Every time I go into the doctor, it's like, your cholesterol could be lower. Other than that, you could lose a little bit of weight, and drinking's not good for you. Get lots of rest and drink fluids. I'm like, well, no shit. I knew that when I was like 14 years old.
But sometimes it's just nice to have the evidence there. Yeah. But yeah, anyway, it was. I do think that the healthcare system, as we know, access to care is extremely difficult. Rural access is there, and my wife and I joke all the time that we rarely go to the doctor, but if we do go to the doctor, 99% of the time we already know what's wrong and what we need. It's just you got to go through the gatekeeping, navigate the American healthcare system to get access to the care or the prescription or whatever it is you need. And so I think there's definitely some interesting things there that we can do that allows bandwidth and labor to be reallocated to where timeframes can go down. And I think we're going to really see a proliferation of, smartly instituted, tech-driven things, especially on the health provider side of things.
Yeah, and I'll be candid, I have not dove in as much as I should. I'm sure I will over the coming weeks about AI and what kind of guardrails they get put up in there with that. But I know that is very much a focal point of the new administration when it comes to, efficiency and using technology and, using that as our friend. We always joke that, the government is way behind the times, compared to the private sector. And so I think that that's one of the big focal points, is them not having that be the stigma, right? That our government is leveraging and using the same technology as private enterprise, and that it's same. And one of the concerns that they have right now, I think, with AI is because we use it on our end. And I was actually just talking to a staff member today about how we train our AI and what learning models do we give it. And it really depends on good in, good out sort of a thing. Mm-hmm. And, what are the endpoints that you're pointing the AI to really look at? So when a question is asked, or when that AI provides you with the feedback, if you're missing an endpoint, if you're missing certain data, if you're giving it a bad endpoint, or you're giving it skewed information, then it's going to have that algorithm and give those answers. And so I think that that's going to be one of the things that they're very much watching, is as these healthcare companies start leveraging the AI, as we were talking about, then, what kind of making sure that carriers, payers, other people that are using them aren't, restricting or forgetting about certain things, treatment options, prior auths and restrictions, and that they're not being skewed kind of in their favor. I think those are going to be the things that ethically they're looking at when people are deploying a lot of these AI tools.
Yeah, I hope somebody makes that. Remember the old Microsoft paperclip thing that used to from like the 90s and the early 2000s where the Microsoft, you got to find a GIF of this, the Microsoft paperclip where he was like, hi, let me help you. That's what our new doctors are going to be like over the next 4 or 5 years. So I'm interested to see what some of these AI avatars are going to look like.
How do I not remember that?
Dude, you're almost as old as I am. You'll recognize it. The paperclip with eyes, like it was really famous on all the Microsoft.
All I know, I miss Windows Vista. I do know I miss that. You know, it was a deep cut. It was good.
Yeah, I got 2 more, things to cover. The last thing of interest
that looks like not a paper clip. I'm not going to say that looks terrible, but oh my gosh,
he'll put it on the screen.
Yeah.
The Virginia and Utah announced they're going to a birthday rule on the supplement side of things, or at least a modified
here in Utah.
Yeah, version of it, and I think that's a catch-22.
Like everything, I think unintended consequences. It always sounds good to expand access to more people and not restrict based on conditions, or make it easier at, even if it is within the same company, because that's what the modified is here in Utah. It's within the same carrier. You can change and forego underwriting. It's a good idea and everything else, but ultimately at the end of it, these carriers have to underwrite risk. And when you eliminate some of those, and you can't allow them to properly rate based on underwriting, and you waive some of that, rates are going to go up. They always do. And then as an unintended consequence, always, you just price a lot of the people out of the market over time. And initially it's good for the first year, the second year, but by the time you get into year 4 or 5, I mean, ultimately, you have to weigh the cost benefit of it. Like, how many people did this help versus ultimately how many did you price out of the market with it? That's the way I look at it, at least.
Yeah. It's something to watch. People are closely watching what things are happening with supplements on that side of the house when, Advantage plans have gone through kind of the funding environment that they've been the past couple of years. But just something that I thought was interesting.
And if to all my friends out there that I talked to and had discussions with, if you're filing Medicare Advantage plans, you should be looking at all the states implementing birthday rule rates, because as you look at the filings and those MedSup consumers, and you can look at those people with a 9% rate increase one year to an 18% rate increase or whatever, and those people price out of the market, what do they naturally get? A lot of times it's Med Advantage plans. So just, somewhere to look when you're doing your filings.
I agree. I kind of saved this last, headline for last, but just because I think it was pretty amusing. But JAMA, the Journal of American Medical Association,
JAMA,
Yeah, they did a survey, where they had secret shoppers shop ship counselors, and the results were very amusing to me at best.
We'll call them poor.
Yeah, they did not bode well for the ship programs and the ship counselors that they talked to. And I think they said that, the initial statistic was only like 40% of the people that they tried to, these ship counselors that they reached out to, would even call back.
Yeah, so 6 out of 10 of them would never even dirt the call and never even respond or help them.
Yeah. And I am very happy that secret shoppers are still being utilized of that. Back in our day when we used to do all these community events,
when they'd walk up to you with a clipboard and look at you and start writing down, and you're like, "Hi."
Yeah.
Yep. Here's my name. Yep.
Yeah. My favorite was the lady that rolled up to me in the Jazzy at a retail event and pulled out the secret shopper form right in front of me and started filling it out.
And used the table to do it.
Yeah, because I said hello to her, she said that I called her over. I called her over.
Yeah.
And was like, "Hey, let me help you with your Medicare." And even though I very much knew what was going on, and I got a CTM the next day, and I was like, "What the?" Anyway, secret shoppers. I'm glad to see they're still being utilized. I think I'm glad to see that they got trained on going after some of these ship counselors, but the results were not necessarily great.
I can't remember, same thing, Mosiah, please post the link on this episode for that JAMA survey, but it was, you're right, more than 50% never responded. Those that did, there's a large portion of them that could not accurately navigate a provider directory, which is the most basic thing, to be candid with you. So most of them couldn't properly navigate and tell whether doctors were in network, and very few of them gave accurate information. So the secret shopper validated the information they were given from the ship person versus whatever resources they were given and kind of checked it, and the information that was provided was inaccurate.
Yeah, the statistic here was accurate information's ranged from 26% to 94%, depending on the
That's
ship
a pretty
counselor.
broad. I'm just going to say that is very broad. 26 to 94% is a big spread there.
Yeah, and I can't remember the other statistic off the top of my head, but it was about less than half when they presented that they were dual or on Medicaid knew how to answer.
I'm just going to throw my hat out there. Just if there's a government contract out there, I pretty much think I heard Doge had some like 1 question or 4 question survey out there that they had paid $400 million for or something. If there's any of those government contracts out there, I want one, because if the data result provided is, anywhere from 26 to 94% is the number, I'm pretty accurate. I could conduct a survey and give, very good results.
We'll put the link to this survey in this article or in this episode at the bottom, because it is pretty amusing. And, I do celebrate a little bit in dunking on the ship counselors, just because I feel like there was an alternate universe that existed where that became the future.
That's where they had allocated, hundreds of millions of dollars to ramp up the navigators, right? And so when you're talking about ship counselors and hundreds of millions put into navigators, you're basically saying, this is what that is. Let's go heavy on that. Let's reinvest into that. So as much scrutiny as there's been in the broker community, of course, I'm practical. I'm not quite like a rabid, cornered animal these days, but I'm getting close to the 2, 3, 4 years of being drug out in town square. I feel a lot of vindication in saying, so that's the alternative. So we want to put hundreds of millions of dollars into a vacuum and just double and triple down on that. Yeah, that sounds like a great idea.
My favorite ship counselor anecdote is Stanton, whose office is literally right on the other side of this wall, right here behind this sign, has a client who is a ship counselor, but asked him to write her Medicare policy because she didn't feel qualified to write her policy. Yeah. So or make her own recommendations. So anyway,
and that's 100% a true story. It's valid. So
brokers, brokers are awesome.
Yeah. So again, kind of validating everybody's having to justify their existence these days. So I think that we continue to do that.
Maybe that survey can get passed on to MedPAC. When they
that's great.
Wonder about how brokers do and what their job in the ecosystem is.
We should link that everywhere. And and again, it all comes down to what's their stake, what are they paid to do? It sounds like they obviously don't get high level training, and it sounds like these individuals aren't really that financially invested into giving good outcomes to those beneficiaries, right? So I can guarantee you, if a broker had somebody calling them, they wouldn't call back the lead only 4 out of 10 times. They would call them back 400 times to every one of those leads. I can tell you that much.
Yep.
So, never do you hear of a broker who's like, I called and wanted somebody to help me with my Medicare, and I couldn't even get a call back. It is the opposite. It's
show me your comp plan. I'll show you the behavior.
Yep. So, there's always stuff to fix. There's always improvements that can be made, and we're not saying that the broker community is perfect. It is far from it. But I would take the alternative of continuing to make adjustments to the broker and agent and agency sales environment and that supply chain that already exists, and tweak that versus hundreds of millions of dollars going into this vacuum and funding more of these ship counselors and navigators. Yep. So anyways.
All right, guys, that's all we got for you this week. It's a lot.